Trying to conceive and feeling overwhelmed and confused with unhelpful information and advice? This podcast is for you. Welcome to Don't Tell Me to Relax. I'm your host, Hannah Pern, a fertility acupuncturist and passionate advocate for better fertility education and support. Our aim is to empower you with information to support your fertility journey and provide a community for connection with people who get where you're at. If you'd like to join us or work with us in clinic in London or across the UK, all the information is in the show notes at the end. This podcast is sponsored by Invivo Healthcare, the human microbiome company restoring human health and ecology with seamlessly connected testing, supplements and education. The Invivo team of scientists and practitioners work alongside healthcare practitioners to expand their expertise. As pioneers in testing, Invivo Ecologics range delivers a unique insight into the gut, vagina, oral and urinary microbiomes with unparalleled detail and accuracy. Their supplements are crafted using live commensal cultures and selected botanicals and designed with specific microbes in mind for a truly targeted approach. Invivo is a go-to in my clinic for microbiome testing and supplementation. For more information, visit invivohealthcare.com. Hello everyone and welcome back to the new series of Don't Tell Me to Relax. A brand new year, so I hope it's getting off to a good start for you. We have some great episodes coming up for you this year. Katie is going to be joining me for some more fertility awareness episodes, and we've got some excellent fertility expert guests lined up. But before we get into all of that, we are kicking off the new year with an episode all about acupuncture for fertility. Because as you know, it's what we do in this team, it's what we love, and it's what we get asked many questions about. So today I am joined by all of our lovely affiliates who are based around the UK. And like our team in London, all our affiliates specialise in acupuncture for fertility and women's health. And as a team, we meet weekly to discuss case histories, do ongoing learning and share our skills so we can provide you with the very best care. Today is going to be a chance to meet the team and get answers to the most common questions we get asked about acupuncture. So today I am going to start with Annabelle. Annabelle, I would love you to introduce yourself to us, and we've got the biggest one in the list. So, Annabelle, can you tell us, how does acupuncture work?
Yes, hi Hannah. I'm Annabelle Tyndale and I am an acupuncturist based in Scunthorpe in North Lincolnshire and Beverley in East Yorkshire. And it's a big question, isn't it?
You got the hardest one.
I know, and going first, what more can I say? Yeah, it is a big question that we get asked all the time as acupuncturists, and there are different theories about how acupuncture works, so I just thought I'd sort of share some of those. As traditional acupuncturists, we utilise the understanding of health and illness that's been developed over thousands of years. So this theory uses the concept of chi or energy, and this is our sort of life force energy. So it's based on a channel or meridian system where our chi and energy flows up and down the body in channels. And when we are well, we say our chi is flowing freely. And when there's pain, illness or disharmony, the chi is blocked or not flowing as freely. So as traditional Chinese medicine, which acupuncture is a part of, looks at the root cause of disease and treats the symptoms, we're looking at rebalancing the flow of energy to improve our physical, emotional and spiritual well-being. So it's quite hard to sort of explain that to people in a sentence. So I like to think of it as we're looking at the body as a bit of a circuit board. And as acupuncturists, we're working with these circuits to reconnect and rewire the flow of electricity. And I guess in clinic, it is one of the most common questions we get asked. And I often ask clients, if you have a headache, would you take paracetamol? And, often we do. And I always say, do you know how those work? So I think sometimes it's just being curious about how it works rather than having all the answers. But in terms of more modern science, there is a growing evidence base to support how acupuncture works for various conditions. And realistically, when we look at that evidence, acupuncture is working on our central nervous system. So quite often, especially in our busy modern lives, we're in fight and flight mode. So that's our sympathetic stress state. And we're wanting to get into more rest and digest the pause of the parasympathetic nervous system. And that's what acupuncture can support us to do. This process helps release endorphins, our natural painkillers and our happy chemicals. And through these processes, acupuncture can help improve blood circulation, reduce inflammation, help regulate blood sugar, reducing stress, all which can have an impact on our well-being. So some good resources to find out a bit more is through the British Acupuncture Council, and evidence-based acupuncture have some nice detailed descriptions around how acupuncture works. And I often get clients say, if I believe in it, will it work? And, I think for me, if you sort of believe in anything, you maybe get a more positive outcome perhaps. But in terms of, do you have to believe that it works? I don't think so. To me, it just does. I know I'm biased, but that's from my own experience of being a patient and then now an acupuncturist.
I feel like you deserve a round of applause for that.
You're very well.
It's so hard.
It is, like I said, it is a tricky one, but I think, it's just having that curiosity and open mind and just seeing how treatment is for you, really.
Exactly. And I think it's one of those, exactly like you said, you've got to give it a go. You've got to give it a try and see how you feel, because it's so difficult to put into words, isn't it? Like what actually happens. Yeah. Thank you very, very much, Annabelle.
You're welcome.
So, Catherine, I am moving on to you. So, a question we get asked a lot is like, what's the difference between acupuncture and fertility acupuncture? Like,
hi, Hannah. Yeah, just to do a quick introduction, I am Catherine De Rosa, and my acupuncture practice is called Exhale Acupuncture, and I'm based in Wallingford and Didcot. And I also work with the London Acupuncture Clinic at their site in Windsor. So yeah, your question, it's a really good question, and I think useful for those who have heard that acupuncture is great for fertility. There's quite a few areas that are kind of worth looking into, really, to see the difference between like what is normal acupuncture or general acupuncture and fertility acupuncture. So I'd say that kind of general acupuncture covers such a broad spectrum of health concerns. So it could be ranging from pain to digestive issues, headaches, stress management, whereas fertility acupuncture is still very similar to regular acupuncture, but it has the addition of we're really honing in to address kind of reproductive health and treating the channels and points that really target this area. The points that we use are often on the lower abdomen, the lower legs, wrist, head, and lower back. The number of needles we use are often far less than if you were having acupuncture for, say, a musculoskeletal condition, and we tend to use the finer needles that are on the market. No acupuncture needles are that thick, but we do try and use the more kind of the smaller needles that create those kind of subtle energy changes in the body. So the question is, I suppose, is what are we trying to achieve with fertility acupuncture compared to general acupuncture? And overall, we're aiming to create the most optimal internal environment for conception and onward pregnancy that is possible for that person. So we always treat the individual, not the kind of generic infertility or fertility problems. So what does this mean? I suppose in an ideal world, we always like to have 3 months to give us time to make an impact, but we'll always meet people wherever they are on their treatment journey or on their fertility journey, as well as treating what we're presented with in the same way as you would if you were going for any acupuncture appointment. We will also focus on like regulating the menstrual cycle, increasing the blood flow to the ovaries and the uterus, and regulating sperm health for the men that we see. And finally, stress management. So that's quite a big one and common in what we see. We can't take away the stress, but we can use points that really help the body to build resilience to the effects of that stress. So another difference between general and fertility acupuncture is that you should expect to have treatment over a longer period of time, say, compared with if you were going to see somebody for like a musculoskeletal condition. Another aspect of fertility acupuncture is that we we're always adjusting our treatment approach depending on where you are in your menstrual cycle or your IVF cycle, or say ovulation induction. For instance, like if you've got your period at the time when we're seeing you, we'll probably be encouraging like a good flow of blood, whilst also treating on an emotional level for like the inevitable kind of disappointment of not being pregnant that month. Whereas, say, if we see you in your follicular phase, we'll be focusing more on like follicular development and your uterine lining. So along a website, I suppose, alongside when you're having fertility treatment also, we would work with each phase and really try to enhance your response to the treatment you're having or manage the side effects of the medication. One of my favourite treatments actually is like post-egg collection. And I think it's often a time that's quite overlooked as the focus is so much on kind of reaching that day of transfer. But it's quite a big procedure. And I remember one lady coming in, she had quite a lot of pain and bloating. And after the session, she really felt as if all that pressure had been released. And I remember her saying, she didn't understand what acupuncture really did. But she said that was the treatment where she went, wow, actually, it really does do something. So yeah, that was a lovely one to have. But also we have, as fertility acupuncturists, we have so many different kind of tricks up our sleeve. So if somebody isn't, say, responding well to the stimulation phase during IVF, we can bring out kind of extra tools from our toolbox. I had a lady recently, actually, and she was feeling pretty rubbish that her follicles were developing so slowly. We upped the treatment and used electroacupuncture. And on her next scans, the clinic were amazed at her response. And she ended up going on to have like 12 follicles collected, when at the previous time they were thinking only maybe like 4 or 6 would develop to being collected. Yeah, it was great. And I think having a specialised interest in fertility is really like where the difference lies between general acupuncture and fertility acupuncture. So like when you're choosing an acupuncturist for fertility, like where do you start? The AFN website is great, and many fertility acupuncturists are registered on there. So you know for certain that they will have undergone additional training in fertility. All of us who work with the Hannah Pern team, we have either completed or we're working towards the advanced diploma in fertility, which is probably like the highest standard of training currently available to us. You'll always be working really closely with your fertility acupuncturist. So I think it's so important that you feel a connection with them. We ask heaps of questions, and honestly, nothing is too much information. The level of detail we go into, some people are like, oh my goodness, I've never been asked about my poos. So much detail, or, your menstrual bleed or what have you. Yeah. So another difference with fertility is really, and this is the most important one, which is probably why I've left it till last, but is relating to the knowledge that we hold relating to the fertility journey. I find that many people that come to me will often be feeling lonely and also overwhelmed with all the information that's out there related to like what you should or shouldn't be doing. So when you have acupuncturists with someone who's specialised in fertility, you can expect to gain insight and education relating to your own fertility path. This would be both from Chinese medicine and a Western medicine perspective. Some areas that we can help is like understanding your fertility and your menstrual cycle, to become aware of like lifestyle factors that can influence your reproductive health, and also navigate the system that's often quite a minefield. Make you aware of your options and kind of decipher test results and highlight areas that might need additional testing. We're always searching for that kind of missing piece of the puzzle and looking for the root cause for why fertility or getting pregnant is challenging for you. It's not unusual actually for us to see test results that have been passed as normal, but actually there isn't something, there's something that's not quite right. One incident that kind of springs to mind is that I recently saw a man who'd been told by his fertility clinic that his semen analysis was normal. Him and his wife had had 2 unsuccessful rounds of IVF with poor fertilization rates and not many making it to blastocyst. they decided to come for acupuncture. And actually, when I looked through his results, it was clear that something wasn't quite right with his sperm. There was high viscosity, and that can often indicate like presence of an infection. So I referred him on to Claire Mooney, who a lot of your listeners are probably aware of already. She's at Fertility Solutions. And yeah, sure enough, his semen culture came back abnormal. So they're now under the care of a urologist for treatment. And I'm sure many of us have stories like this. And I honestly believe, had I not specialised in fertility awareness to the level that I have, I may not have picked this up, and I might have just gone, oh yeah, your sperm analysis is normal, let's move on. Prepare for another IVF cycle with potentially disappointing results. So I know I'm obviously biased, but I honestly think that our role in somebody's fertility journey really cannot be underestimated.
Yeah, and you know what, Catherine, I think that idea that when you come for fertility acupuncture, I always say it's not just about the needles, it's about that whole additional guidance and support that you get, that people are often come to clinic, and I bet you get this too, where they're like, okay, I didn't realize that these were all of the things that, would happen in a treatment, because I think people often assume they're going to come have some acupuncture and go again. And we, and I know you do too, we spend a lot of time giving information, guidance, talking about clinics, consultants, gynecologists, tests, investigations, things that they might not have thought about previously, that can really help inform people so they feel empowered, because it's that getting the information without feeling completely stressed and overwhelmed because you're getting your information from Google. That is a huge part of what we do, I think.
Oh, it really is. Yeah, that level of support, I think, because we do work with people for a long period of time, don't we? And you build up that relationship, and often you find people almost being like scared to hope. And I always say to them, like, that's our job. We'll hold the hope for you.
Yeah.
When you don't feel like you can hope yourselves.
Yeah. Lovely. Thank you.
Oh, you're welcome.
So I'm going to move on to Nicole. And Nicole, I'd like to ask you about this 3-month prep. And, this idea that we can support people to prepare for pregnancy, or we can support people to prepare for fertility treatment, no matter what that is. So Nicole, as you are who you are going to tell us about that. Why do we say this?
Yeah, so I'm Nicole. I'm from Prep and Poke Acupuncture. I live in Manchester, and in the new year, I'll be based in Prestwich. Now, I always say it's never too early to prep and poke. And that's not me saying there's no benefit in starting treatment when you're in the thick of trying to conceive or starting fertility treatment, because there definitely is, and I'm sure we'll touch on that. But preparation, where possible, is key. Now, an analogy that I always use, and you probably use, is that preparing your fertility health is like training for a marathon, not sprinting out the door. Starting treatment early or before really gives your body and your mind the best chance to perform at its peak. Now, often we'll hear in all of these fertility discussions that 3 months is the sort of ideal time to prepare for your fertility. And that's generally because it's the kind of sweet spot for significant changes. And there are many reasons for that, but I'll just touch on a few. So one of the big things is that starting acupuncture today influences the follicles that will be ready in 3 months. So we can't influence the follicles as much that will be ready next month, but we can influence them in 3 months' time. It's also the same for sperm. So the treatment you have today will influence the sperm that will regenerate in just under 3 months. Not only that, but it allows us to collaborate and make significant changes to a person's menstrual cycle. Generally, within 3 months, you can make quite big changes, such as increasing cervical mucus or lengthening the luteal phase, which, of course, optimises and increases your chance of successful conception. Now, I think it's pretty common knowledge now, but nutrition and lifestyle changes typically take around 3 months to impact our health. So again, the 3-month preparation is beneficial when it's possible. It also provides us a little bit of extra time to do additional testing, which sometimes actually alters the path in which the client goes down. So, for example, I worked with a client, she'd had 1 unsuccessful round of IVF. She'd had IVF treatment again, which it unfortunately resulted in a miscarriage.
And she started to work with me. And just at that 3-month mark, we'd done a vaginal microbiome test, which identified quite a lot of issues with her microbiome. So we worked on the microbiome and she delayed her IVF treatment. Now, when it comes to having the IVF treatment again, which she did have, although her microbiome wasn't perfect, it was significantly better. And not only did she get pregnant, but she had a full-term birth. So sometimes having that preparation period, although it might feel like you're delaying the process, it can provide a better outcome. And also, like the other women have mentioned, fertility acupuncture isn't just about the needles. There's so much education, advice and guidance that we're able to offer you in these sessions. And when you have the time to absorb that information within those 3 months, then you can use that information again and again and again. It's amazing, really, what a client will learn. And I think you mentioned that on your podcast, Hannah. Often you'll have people say, why has nobody told me this? I wish I knew this before. And I suppose, staying true to my stamp of authenticity of no beating around the bush, the body does have a timeline and it's often different to ours. So we want things now and we often get things tomorrow. But with fertility, we sometimes have to work on that a little bit longer, a little bit harder. And another analogy, I suppose, which I often see and hear in the acupuncture world, is that we don't go to the gym once and get a six-pack. So if you're listening to this and you're thinking, oh God, I'm about to start fertility treatment, or I'm already trying to conceive, don't panic, because there is still a lot of benefit in having treatment now. And I suppose the number one thing is, which probably every acupuncturist will touch on, is that we can reduce the stress and switch the body from fight and flight to rest and digest, which I'm sure if you're going through fertility treatment or trying to conceive, a little bit of help in the stress department is not going to go amiss. We can also pretty much instantly support the blood flow to the uterus and manage symptoms at key phases of your menstrual cycle, such as implantation or embryo transfer. It is more reactive than proactive, but it's still highly effective in helping optimize what's happening right now.
Yeah. And you know what? Whenever I've spoken to like embryologists or consultants, I mean, the fact that embryologists and consultants and fertility doctors now work with acupuncturists and nutritionists always blows my mind. And it really does go to show how far we've come. But a lot of the time they'll say that they can really see the difference behind when people have prepped and prepared and spent some time sorting out their health and their lifestyle and getting ready for IVF than those that just step into the door and start IVF immediately. And now, obviously, there's always a time pressure, isn't there? But, the feedback is from people who are in the IVF clinics, they really do see that it makes a difference. So, the old days of just walking into an IVF clinic and starting has definitely is shifted, I think, significantly. And people really do value the partnership they get by working with us and with the preparation they can do with us.
Yeah, absolutely. I think it's a difficult conversation to have sometimes, particularly if, one fertility treatment has been unsuccessful and they're being asked to go straight into another fertility treatment.
Yeah.
It's a difficult conversation for us as fertility experts to say, actually, it might be beneficial just to take some time out in order to, prime and prep both you and your partner so you're in the best possible position going forward. But when clients actually do that, even if it's not successful, they can look back and think, well, I actually did the work.
Yeah, exactly. Because that is the reality, isn't it? Let's be honest, that, sometimes people do everything. They literally throw the kitchen sink at it and they do not get the outcome that they want because fundamentally fertility is unfair. And there is a lot about fertility that we cannot explain yet. The medicine has not been around for long enough. We don't understand all of the reasons why somebody doesn't get pregnant or why they go on to miscarriage. We have theories at the moment, but not 100% definitive answers. But I think exactly like you said, is that when people have prepared and they've done everything they possibly can, everything that's within their control, when they get to the end of that cycle, even if that cycle is not successful, obviously that's heartbreaking and I'm not taking away from that at all. But people don't think it's because of something I did. There's always that it's because I drank coffee, it's because I drank wine. When they've done the work and they understand what they can and can't do, I think it really makes people feel a bit more in control and empowered no matter what the outcome.
Yeah, I think that's exactly it, Hannah, is that when you're trying to conceive and it's not working, or you go for fertility treatment and that's not working, you're
at the hands of other people. Whereas when you understand fertility and what it is you can do to increase and optimize your chance, not to be perfect, it gives you a sense of control that you're able to take forward.
Amazing. Thank you, Nicole.
Thank you.
Stacey, I'm going to come and ask you a question now. So one question we get asked a lot about acupuncture is acupuncture safe and does it hurt? So can you just tell us a little bit about that, please?
Yeah, sure I can. My name is Stacey Davis and I'm an acupuncturist in Bournemouth in Dorset. And having just completed my acupuncture appointment this morning, I can categorically say it doesn't hurt. However, you do have some different sensations going. So there's certainly some different feelings. The needles used are really, really thin. They're nothing like an injection needle, and most people can barely feel a thing when they're inserted. Maybe just a light pinch or a little sensation, very subtle. But when us acupuncturists hit what we call the chi, which is the sweet spot, it's where the needle is hit the exact point at the exact depth. That activates the central nervous system to stimulate the body's natural healing abilities. And at that point, you might notice it feels a bit different. Still doesn't hurt, but there might be a gentle tingling, a warmth, or a dull ache around the needle. And it's actually a sign that the needle's doing its thing. And while it might feel a bit stronger, it's definitely not painful. I can assure you I have many clients asleep on my couch after the needles are in. And also it's really safe, especially when you're pregnant or trying to conceive. There's lots of evidence-based research around its safety. I'll let you Google it. But basically, as Annabelle said, there's some information under the British Acupuncture Council website, under the AAC, which is the Association of Acupuncture Clinicians. But there is an important safety announcement coming up. It's really important that you find a qualified acupuncturist. Most of us have a 3-year degree in traditional Chinese medicine and acupuncture or an equivalent degree level training, and we're required to complete hours of continual professional development training each year. We're fully insured and we have to belong to a governing body like the ACC, Association of Acupuncture Clinicians, or the BAC. Another thing is, it's already been touched on by my colleagues, but it's really important you have a connection with your acupuncturist. Go ahead and interview them. They often do, or we often do, a 10 to 15 minute free consultation. Use it. Make sure you like the person you're going to go and see. Ask questions and get a sense of their approach. It's crucial you feel comfortable and safe in their hands.
Exactly, because I always think the discovery calls is a really important part. A bit like when you're trying to find a counsellor, you know, there are lots and lots of different types of counsellors out there, and you need to find one that you feel exactly like you say, Stacey, connected and safe with. So make a few different calls is what I always say to people.
Yeah, I've been interviewed for over half an hour in person by a client before, but she was fabulous. She came for the required 3 months every week, and now I see her every fortnight.
Yeah.
And, you know, it was important to her, and quite right so. You know, she spent a long time with me.
Yeah. And exactly like you say, it's, you know, look up a person's qualifications, make sure that they've got, you know, they're trained to degree standard, make sure that they've got, you know, the further training in fertility. Check out the AFN that Catherine mentioned, the Acupuncture Fertility Network and Fertility Support Network, because, you know, they're going to be practitioners who specialize and have undertaken further training. So, you know, you're going to be in good hands with them.
Yeah, absolutely. Definitely for fertility, you definitely need to go that extra mile and, you know, seek out an acupuncturist who's had proper training.
Yeah. Thank you so much, Stacey.
Thank you.
So, Elaine, I'm coming to you next, because another question that we get asked a lot is about like preparing for treatment, like what to wear, how to prepare. What do you say about that?
Hi everybody, my name's Elaine Otrafanaway. I'm your person in Leigh-on-Sea in Essex. I've been practicing for 11 years and I specialise in fertility for both men and women and in women's health. Well, so how do you prepare for an acupuncture treatment? I would advise that you have something light to eat. You don't want a great big heavy meal, especially as you're going to be lying down for about at least 30 minutes. Wear something loose and comfortable, because I will need to access your lower abdomen, your legs, and your arms. I usually recommend something like a tracksuit or leggings, but whatever you wear, make sure it's nice and comfortable and loose for you. And most of all, I really don't care if you've shaved your legs or not. If I had a pound for every time a patient apologised for not shaving her legs, I'd be a rich woman. You don't have to wear your best knickers neither. And finally, it's always a good idea to empty your bladder before treatment, as there's nothing worse than lying on a bed trying to relax and enjoy your acupuncture nap with a full bladder. Another thing, don't worry if your tummy rumbles. That's just the acupuncture working. It's really common.
Yeah, that does always happen, doesn't it, Elaine, the tummy rumbling? Why do you think that always happens? People always ask me about that.
That's to do with the autonomic nervous system. You're switching from that fight-flight response into that rest and digest response. And that's one of the first things I say to our patients. Your tummy is likely to start rumbling, but it's nothing to worry about. Don't get embarrassed. It's just the acupuncture doing stuff.
And often people say, is there any point in my menstrual cycle I should start?
I personally think no. You can start any time you want to. We'll adjust the needles we use slightly according to what's happening, what symptoms you have. But the sooner you start, the better, really, in my opinion.
Yeah. And so it doesn't matter if you're on your period, it doesn't matter if you're about to ovulate, any time is fine.
Definitely not. In fact, if you're on your period, it probably help with any pain that you've got. So it's probably a good time to come.
And what about people who are nervous about needles? What would you say to them in terms of preparation?
Well, let me know that you're nervous about having needles. Make sure you've had a light meal, and I'll just keep an eye on you. I know what to do if you decide to faint or anything. Fortunately, it only ever happened to me once, and that was with a big strapping gentleman. Oh my God, what am I going to do?
You know what? In all my years of practice, I've had 2 people faint on me, and both of them were male as well. So I wonder, I don't know what that's all about, but it's interesting that that's the same for you as well.
Yeah, a couple of our patients, they've said that their partners are absolutely terrified of any medical treatment, and they're great big strapping men. Yet most of the women have had to come and have all these acupuncture treatments and all the other fertility investigations that they have.
So if you're nervous, say you're nervous, we'll just start with a few needles and we'll take it from there. But I would say 99% of people, I don't know whether you feel the same, Elaine, 99% of people who come are very, very surprised at how relaxing it is and how non-invasive it is in terms of like the thought of having needles to relax does not make any sense until you go and have it done.
Yeah, they often say to me, is that it? I didn't feel anything.
Yeah.
Apart from a slight sensation. No real pain at all. In fact, one of my patients, I can't get her off the bed after. She's so relaxed. She said, oh, is that it? Is it finished? I do have to go home. I said, yes, I've got my next patient. So off you go.
Thank you, Elaine. That's lovely. So Catherine. I think a lot of the time we assume that acupuncture is fertility is around the female. So tell us about acupuncture for fertility for men.
Hi, Hannah. I'm Catherine Heathcote, and I'm up in Wakefield in West Yorkshire. And I've just completed the Fertility Support Diploma because I was seeing so many people in clinic asking me for fertility support that I felt I really needed to do a deep dive into this. Yes, acupuncture can help with male fertility just as well as it can help with female fertility. All the things Annabelle was describing earlier, it applies to the guys just as much as it does to the girls. And we know that there's often, in about 50% of cases, there can be a male factor issue present. So it's super important to treat the couple and see actually what's going on. It really saddens me when people, particularly women, will come to me and they've already had a couple of rounds of IVF. And when I ask about their partner, they'll tell me that they've just had either nothing or just a basic semen analysis and they've not had any further testing. So supporting the men is just as important. I would say finding somebody who is specialist will mean that they will be able to guide you not just with the Chinese medicine side of things, but also with the signposting you for testing, whether there's anything else that needs looking into. There can be quite a few reasons why sperm quality is lower. They're not always physical reasons. Lifestyle can play a big role too for people. So
as an acupuncturist who specialises in fertility, I'll be able to support people looking at their lifestyle and helping them to look from Chinese medicine point of view, but also, as I said, signposting them to other specialists that can help them. I wouldn't want to talk about male fertility without talking a little bit about nutrition and how it is really important that the guys get nutritional advice as well as a supplement review if they've been put on things. Checking out that they are helping them would be really important. The Men in May series that you did, Hannah, earlier this year is a great place for people to listen to, I would say, if they want to get a bit more information about this.
Great. And do you see a lot of men in clinic, Catherine? Because in our clinics, I wish we were 50-50, and I would say we're probably 90-10, so 90% women, 10% men. What's it like with you?
Yeah, I would say it's a similar stat, really. I have had men who've come and who've worked with me, sometimes with their partners, sometimes actually on their own. They've come because they know the issue is with them rather than with their partner. But yeah, it's still massively skewed. Often I will suggest to their partner that they bring the guy in, and the answer I will usually get is, oh, they're not interested in coming, but they're interested in the advice you could give. So
Yes.
It's definitely something that I'm on a bit of a mission with up here to try and get the guys more engaged in coming for treatment because we can really help them.
Yeah. And I always say to people, if I'm working with the female, we're always quite insistent that, okay, we're not working with the man, that we're at least looking at their results. We're reviewing their supplements. We're making sure that they're as good as they possibly can be if they're not coming in for treatment, because I never really want to work with a female for 6 months and then we find out it was male factor. And I know that you will be exactly the same.
Absolutely. And I don't think there are any men out there who would want their partners going through lots and lots of unnecessary treatment. So I would just say, don't be embarrassed, come and see us. It's all very, like private, nobody's going to know why you're coming into clinic. You could be coming for a sore shoulder. So, come and talk to us. And that treatment room is a safe place for you as well to share how you're feeling on that journey, because it's tough.
Yeah, exactly. And I think that if you're somebody who is under a lot of stress, like with work and exactly going through the journey, you might not be talking to your friends about it, that having that sort of space to like unload and de-stress is a really, really important part of like looking after your own health.
Absolutely.
Yeah. Thank you very much, Catherine. Last but definitely not least, Mel. So we've sort of talked a lot around the kind of, theory around acupuncture, but tell us actually what happens during a treatment. When someone walks in your door and they say, here I am, what goes on?
Hi, Hannah. My name is Melanie Cullis. I'm a fertility acupuncturist based in the beautiful Surrey Hills. I'm in the village of East Horsley, which is very close to Guildford and Cobham. So yeah, lots of people are curious about what happens during a treatment, and it's an important question. I think some people imagine acupuncture as some sort of torture experience where they're like a human dartboard and needles are flying at them, and this is not the case. I can't emphasize enough how relaxing a treatment acupuncture is, and acupuncturists bend over backwards to make you the most comfortable you can be, because when you're really comfortable, this helps the treatment work better. So it down regulates your nervous system. That's what Annabelle was talking about at the beginning. It's that fight or flight response, which fertility clients, I would say probably most fertility clients are in. So after the consultation with your practitioner, you'll lie down on a really comfortable treatment couch. In my clinic, this is heated. So it's a bit like lying down for a luxurious facial. Then your acupuncturist will feel your pulses on either wrist, which is how we formulate your unique diagnosis and decide which points are appropriate to you. And we'll be chatting to you at this point as well to make sure you're super relaxed. You'll generally be fully clothed. Elaine was talking about this earlier. So we'll move some clothing out the way as needed. For fertility points, We usually pull up your trousers up to your knees, your sleeves up to the elbow, and we uncover your tummy. You can ask for a blanket if you're cold as well, but we'll always check on your temperature, as acupuncturists are temperature obsessed. The needles are then gently inserted. As several of my lovely colleagues have mentioned, this is not a painful experience. It should never be painful. Most of the time, you won't feel them at all. And I do need to cover this off, as it's not been mentioned. If your partner is male and he's coming in for acupuncture, we never needle the testicles. You'll probably have a heat lamp popped over you as well, or your acupuncturist may use a bit of moxa, which is a warming herb. In Chinese medicine, we love to keep you warm, as this is how we keep all the good blood flow to the womb happening. And so we'll be warming your tummy and your feet especially. Then you'll have a little acu-nap, which is like a lovely little snooze, and you'll be left with the needles in. And you can have some gentle music on or not. And I think a few people have said this, but I should say most clients do fall asleep. So I think that kind of proves how relaxing the treatment really is. And I would also say, if anything is uncomfortable, do make sure you say this to your practitioner, as it will only distract you, and we want you to be super chilled. So we can always kind of move things around if we need to.
Thanks, Mel. Another question that I've just thought of is, after, let's say you've had your initial consultation, how many treatments do you think a person will need? Like, that's often a question we get, like, how many treatments do I need? How often do I need to come? What do you say in your clinic?
Yeah, generally, if we're trying to get you pregnant, we do want to work with every stage of the cycle. So that is weekly. Because that means that we are rebalancing the whole cycle. We're kind of making sure that, you have a really good period, that we're encouraging ovulation, and that we're kind of maintaining the levels of hormones that you need in your body to maintain a potential pregnancy. And the same goes for an IVF cycle. So I think it's been touched on before, but we want at least 3 months, because that is where the recruitment of the follicles and the sperm and all that sort of stuff is the best timings for that.
And how do people usually feel? How would you describe it, how you feel after a treatment?
So I had a lady the other day, and she said she kind of like walked out in a completely zen state, and then her husband said to her, "Can you go every day, please?" And she was just completely zenned out. She'd come in and understandably was just, she'd just come from a fertility clinic, and her head was full, and she just needed a complete down regulation of that nervous system. And yeah, she floated home.
Yeah. That's such a good way of describing it, that people often like they can't find the car keys. I had this the other day where someone was like, "I don't know what I've done with my car keys. I don't know where my mobile phone is." I was like, yeah, that's treatment's really worked, because you're just not quite sure what's going on. And you will always, well, not always, but you will often have a very, very good sleep that night, is what people need to know. Thank you very much, Mel. And thank you, everybody. I really hope that if you're listening, that this has been helpful and we've answered all of the questions. If you want to find out more about where everybody is and check out their websites, then all of the details are going to be on the show notes. And obviously, you can find us all on Instagram. If you have any questions, you are very welcome to get in touch with any of us, book discovery calls, and find out about how we all work, because that really is the best way to find out, how we can support you and what we can offer. So all of the information is going to be on the show notes. So everybody, I just want to say a big thank you for your time today. Well done for doing I don't know whether it's your first podcast, but well done. It's the first podcast that I've ever done with this many people, and it's been great to see you all. So thank you for today. We hope you have found this helpful. If you'd like more on fertility education, please see our Teaching to Conceive free course linked at the end of the show. You'll also find the link to join our community. For more personalised fertility support, you can work with us one-to-one in clinic and online. You can book a discovery call to find out more.